My name is Gabrielle Lenhart. I am currently a master's student at Houston Christian University studying clinical mental health counseling. And today I want to talk to you about major depressive disorder and how I would encourage you to treat that disorder using psychotropic medication. First, let's talk about some of the symptoms of major depressive disorder. So, what you could find is disturbance in sleep. There's a reduction in interest or pleasure. Maybe you're overwhelmed with feelings of guilt or thoughts of worthlessness. Maybe your energy has changed and you feel extreme fatigue. Maybe it's difficult to concentrate or um, remain attentive to tasks. You might see a change in your appetite, which will result in a change of weight. And we also see an overall depressed mood that can even contribute to suicidal thoughts. The DSM-5 classifies major depressive disorder in a variety of ways. It can range from in severity, such as mild, moderate, severe. It may have psychotic features, be in partial remission or in full remission. To appropriately diagnose this disorder of major depressive disorder, we are looking at symptoms that last at least 2 weeks and are not the result of um, a catastrophic event like a death or something serious in that nature. Now, the psychotropic drug that I believe can be extremely beneficial for the treatment of depression, along with many other mental health disorders, is known as Lexapro, otherwise known as escitalopram. This is an SSRI, and why I would recommend this SSRI for treating major depressive disorder is SSRI stands for selective serotonin reuptake inhibitor, and it'll work by increasing serotonin levels in the brain, which that increased serotonin will lead to a regulated mood and reduce depressive and anxiety symptoms. What's amazing about Lexapro is some people find it to be working and improving their symptoms within the first week of taking the medication. Now, it is seen to take full therapeutic effect between 6 and 8 weeks, and that's when people really start to notice an improvement in their mental health. So we see Lexapro being beneficial because it can reduce those feelings of hopelessness that come with depression, and people start to see that their interest in activities comes back again. There are several factors to consider when taking Lexapro. We find people taking 5 milligrams. Most common, you will see 10 milligrams. And up to 20 milligrams. I have heard that they have recently, on the OCD website, started allowing up to 40 milligrams of Lexapro at, as a safe dose for treating obsessive compulsive disorder. But most often, you will see 5, 10, or 20 milligrams taken to treat depression, depending on the severity. Now, that full therapeutic effect that happens between 6 to 8 weeks after taking the Lexapro, often people report significant mood improvements. They're able to handle stress better. They have better concentration and focus. And for people that experience anxiety along with their depression, sometimes they notice a reduction in anxiety symptoms and panic symptoms as well. It is important to note the side effects of taking the Lexapro as well. The common SSRI side effects we see are headache, nausea, maybe some nervousness, a little insomnia, weight gain, or sexual dysfunction. And depending on the individual and how they respond to this medication, those side effects can fade over time and be present more initially. It depends on how the individual's body reacts to the medication. Thankfully, there are options. If side effects of the SSRI are not favorable with the patient, you can reduce the dosage um, or see how they adjust as time goes on the medication. It is important to talk about the prevalence of major depressive disorder. We see over a 12-month time period, 7% of adults in the United States aged 18 to 29 will experience this. We see that this is threefold higher in the in the prevalence in individuals over the age of 60. Um, there is the highest prevalence in females, and sometimes this peaks in adolescence, but women experience major depressive disorder twofold higher rates than men, especially between the time they start menstruation to the time that they stop. In the United States, we see from the year 2005 to 2015 that there has been an increase of youth that have reported symptoms of major depressive disorder. Now, this could be for a variety of different reasons, such as temperament, genetics. If there is a family member that struggles with major depressive disorder, it's more common to find that. Well, although I said that females are more likely to have it after puberty, it turns out that male children are more prone to developing depression over female children. Now, why I am very much advocating for Lexapro is in several studies there, for example, there was a meta-analysis done on escitalopram that consistently demonstrated it had greater efficacy than other antidepressants. So the SSRI Lexapro is one of the most prescribed SSRIs out there. And I believe this is because several studies, meta-analysis of studies, have shown that it is proven to be superior to other antidepressants, especially citalopram, otherwise known as Celexa. Simply reading testimonials of the drug Lexapro can be very encouraging. We see that up to 68% of individuals taking this drug have a positive experience on it, which is another reason why I would advocate for it. Um, in the testimonials, we see people saying, this drug has saved my life. We see people saying, I finally got out of fight or flight mode. Something that I think is important to note is the window of tolerance. So, although I very much advocate for Lexapro, I also advocate for psychotherapy. And those two work together. So, I believe psychotherapy can be more effective when someone is given the extra help and boost from Lexapro. This is called the window of tolerance. Lexapro might give someone the energy, the needed mental clarity, focus, um, decrease in symptoms to make that therapy work better, more effective, and more worth their time and money. So the two really go well together. So there's controversy over whether or not children should be taking psychotropic medications and whether or not some symptoms are due to development or a variety of things. And there's so much growth happening in a child's brain. However, we do see Lexapro doses in an adult range and a pediatric range. So, what we see is the FDA does approve um, major depressive disorder that people start on 10 milligrams. And if that doesn't work, the maximum is 20 milligrams here. But again, I have seen people be recommended up to 40 milligrams, but this website specifically says between 10 and 20 for that adult dosage, depending on the severity and response to that treatment and the presence of comorbidities and the pediatric dosage. So if a child aged 12 and older, so this is not for individuals under the age of 12, but if 12 and older is really struggling with major depressive disorder and meets that criteria for that diagnosis, the recommended dosage for Lexapro is 10 milligrams once daily, and the maximum is 20. So we actually see this being the same as the adult dosage. Well, again, we have to look at several factors, especially when it comes to children and their developing brain. And next, I would like to talk about culture and or religious factors that influence someone's perspective on taking Lexapro. In religious factors, there has been a common message that depression may be due to a lack of faith, which we know is not the case. But sometimes that is put on others or shared with others that they have a lack of faith, which could influence and increase shame that is experienced when taking an antidepressant, such as Lexapro. In the extreme religious views, such as in Scientology, we see individuals equating um, psychiatric services and medications prescribed as full-blown quote unquote evil, and people will just absolutely refuse that form of treatment. The people's social environment playing a huge role in their perspective and if they're willing to take such a medication. We see if their relationships are welcoming towards it or not. That can influence them. If they have the support from their sphere of influence in their family and in their friends, that'll make a large impact. And it's just interesting to think about. We often, maybe in the religious sphere, fear what SSRIs could do and if they're appropriate and if they're a lack of faith, but we don't stress enough about major depressive disorder and the symptoms of that and what that could do if untreated. That, if untreated, I believe is way more harmful than getting a psychotropic medication to help you. And this can be short term. Sometimes people need it for a season, quote unquote, in their life, which may be months or a couple years. It's a large part of working with antidepressant use, maybe for the therapist, will be working through that shame piece, helping people make that decision if they want to for themselves and not for others, not to appease a lot of their influences, but we respect that that is a huge part of their decision. Also, other different cultures will have a variety of views on SSRIs, and it is important to talk to your client and see where they specifically are and how they feel about those views that they align with, and just ensure that they're getting the best help for their mental health as possible. I do believe in several cases that might involve Lexapro, and again, it might be short term. And where I am, and especially if the client comes from a collectivistic collectivism culture, it's important to respect that the views of the family and their social influence matter greatly and to incorporate those into treatment. So, where I am getting a lot of my information that I have shared today is from Psychopharmacology for Mental Health Professionals. This is by Ingersoll and Rack. And the other source is the DSM-5, written by the American Psychiatric Association. I will list all of my references in the comment section below here of this video. Other sites and references come from Stat Pearls, which is a place to find scholarly articles. Those will be linked below, as well as a couple websites. So thank you for listening, and I hope you feel more educated on the incredible impact Lexapro could have for treating major depressive disorder. Thank you.